Hey everybody, my name is Shelley Anthony and I am a dental hygienist with Senior Dental Care. I currently live in Florida providing care to the nursing homes in the greater Jacksonville area, and I am really excited to be with you here today. I've been practicing dental hygiene for about 27 years, so I want to thank you so much for taking the time to watch this webinar. If you have any questions, please submit them in the Q&A box below. Dr. Flesher, one of our dentists, along with Jeannie Jandek, a fellow hygienist, are also standing by to help answer any questions. And of course, if you're watching this at a later time, you can always email me at santhony@myseniordentalcare.com. In today's webinar, I will help the caregiver understand the importance of good oral care as it relates to proper care of removable dentures and partials. I'm also going to be reviewing the care and storage of removable partials and dentures to aid in the prevention of oral and systemic health issues. So let's first define what a denture and a partial are. These are removable appliances that replace missing teeth. The denture replaces all of the teeth, and the partial replaces selected missing teeth. Now, these appliances, and I'll be using that term interchangeably, these appliances help to improve smile and speech. They also support facial muscles, and they also help to restore chewing function. But what I find most rewarding is that it increases the self-esteem for our residents. There are important facts to note for residents who have dentures and partials. Just like natural teeth, plaque and calculus or tartar can collect on and around these appliances. This creates oral infections, which ultimately can affect our overall health and well-being. Now, good oral health can significantly decrease health issues such as pneumonia and MRSA. Ironically, these are the two most common bacteria that are found on dentures. Denture care and removal reduces the incidence of oral infections and health conditions. By removing these appliances, we are allowing the tissue to breathe, rest, and receive beneficial exposure to antibacterial agents that are naturally present in saliva. Now, as I said before, just like with natural teeth, plaque and calculus can collect on and around these appliances. Plaque is a very soft, sticky substance film that clings to these appliances. It's full of bacteria, and that's what we brush off every single day. But when we are not removing this plaque quick enough, within a 24 to 48-hour period, that plaque turns hard, and it's called calculus or tartar. This just gives a greater environment for more plaque and bacteria to grow. Now, once it is hard, we can't remove it with just normal daily hygiene practices or even denture products. That's where I come in. You need a professional dental cleaning. The two most common effects of poor oral care and non-removal of these appliances are stomatitis and angular colitis. Stomatitis is mouth inflammation, redness, and infected with yeast. And this typically occurs under the upper denture in the palate or roof of the mouth area. This can also appear underneath partials too. Now, angular colitis is a subsequent infection by the same yeast as stomatitis. And this appears as redness and cracking of the corners of the mouth. It can be really, really painful. I also want to mention that people who wear removable partial indentures experience a gradual process of bone resorption. This is a decrease in bone density and volume. These appliances put pressure on the gums and consequently the bony ridges beneath them. Therefore, by wearing these appliances for a prolonged period of time and not removing them regularly can only accelerate this process. Now, what happens with this is it presents a lack of retention and comfort for the denture wearer. A lot of challenges happen the more that this bone is resorbed. The information I'm sharing with you today is intended for the caregiver, and I would like to share with you some dental tips that are meant to be simple yet effective. Always approach the resident with compassion and patience. Be transparent. Tell the patient what you're going to do before you do it. You want to communicate very simple instructions, clear and concise. I have found this really helps to reduce any fear or anxiety that they may have. Now, if you have a tongue depressor available, that's really helpful to help retract the cheek for better access. And by all means, please do not force any dental care on a patient. If they're non-compliant, try a different time of day. Sometimes residents do better in the morning than they do in the afternoon. Sometimes they do better in the afternoon than they do in the morning. I've actually seen residents do better with one caregiver as opposed to another caregiver. So these are just some simple tricks to try. And finally, denture removal should be done gently by placing a gloved finger alongside of the denture and breaking the seal in between the denture and the mouth. Partial removal can be done by using the clasp of the partial by loosening and gently lifting out of the mouth. So let's talk about daily denture care and storage. You always want to place a towel in the sink or fill the sink up with water. And what this does is it prevents breaking the denture in case you drop it. You'll rinse the denture off to remove any loose food or debris, and then you'll take a gauze or a tissue and remove any adhesive that may be present on the denture or partial. Use a denture brush or a soft toothbrush to remove plaque and bacteria. Now, a denture brush, those bristles are specifically designed and arranged to fit in dentures. But if you don't have a denture brush, a soft toothbrush is just fine. Use hand soap, mild hand soap, or an over-the-counter denture cream or paste specifically designed for denture cleaning. Do not use toothpaste. It's too abrasive and it can cause microscopic scratches on these appliances. Always rinse your denture off before you replace it in the patient's mouth. When we store these appliances, we're going to store them in a denture bath or cup. We'll submerge them under fresh, cool water or a denture cleaning solution. This prevents drying out, losing shape, becoming stiff and uncomfortable for the patient to wear. The ideal time to soak these appliances are at bedtime. But if you have a resident that is reluctant and doesn't like to sleep without their dentures, you can do this during the day and soak them for about 4 or 6 hours during the day. You always want to store the container in a safe place away from an area where it can't fall off the counter and break. By storing these appliances correctly, it prolongs the life of the denture. So let's review the ideal daily recommended regimen for denture and partial care for the resident. Okay, so PM, bedtime. You're going to remove the denture. You're going to rinse it with water to remove any excess food or debris. You'll take a gauze or tissue and remove any adhesive. Then you will place it into the denture bath with a cleaning tablet. This will soak overnight. What this does is it reduces and kills the bacteria. In the morning, you'll come in, you'll remove this denture out of the denture bath, and you're ready to brush. You'll brush this denture or partial thoroughly using the mild soap or the over-the-counter denture cream. You'll rinse thoroughly before placing it in the patient's mouth. Go back to the denture bath and remove that water, clean it out, and clean the denture bath so it's ready for the next use. If a resident refuses to sleep without their denture or partial, just follow the same routine. Soak, then brush. Soak as long as you can during the day. This can be done while they're watching TV or taking an afternoon nap. 4 to 6 hours a day is recommended. Now, in addition to daily denture and partial care, it's key to maintain oral care of the mouth. And we're going to do this upon removal and placement of the appliances. You're going to use a soft toothbrush. You're going to brush the gums, the tongue, the cheek, and the roof of the mouth. This removes plaque and it stimulates circulation in the tissue. It also reduces oral irritation and bad breath. If you have a patient that has limited access or is challenging, you have a hard time getting access into the mouth, you can always use a washcloth or an oral swab. By dipping the oral swab into an antibacterial mouth rinse, this is also beneficial to plaque removal. Just always remember that dental health and daily oral care, to include removable dentures and partials, are crucial for our residents' overall health and an important aspect to the quality of their life. We hope this webinar has been informative and helped to better explain the importance of good daily dental care for our residents who have removable partials and dentures. Please be on the lookout for a follow-up survey. We would greatly appreciate your feedback. And from the entire Senior Dental Care team, we truly want to thank you for all that you do. Thank you.